كلمات التهمات من شر ما خلق بسم الله الذي لا يضر مع اسمه شيء في الأرض ولا في السماء وهو السميع العليم اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. So today I have a little discussion about COVID, the disease itself, the vaccination, some misconceptions that we have. I'll start with a little recap over the last year. If you remember, about February, March is when we started knowing about COVID-19 illness from coronavirus, and started off with a few cases up in Oregon, then Washington State, and then it really spread out throughout the whole country. And it became so prevalent that if you look at what happened early on in New York around March, there was one suspected case, and they were so worried about it, so the government totally denied having had COVID, even a suspected case in the state of New York. And later on, it went so much prevalent in across the country. And New York was really affected a lot. If you remember all the videos that we saw, how especially the Muslim community in New York also got affected. There was not only disease, illness, deaths, there was overwhelming of the funeral homes and the burial centers in the state of New York. So initially, we didn't know much about the disease. There was a lot of anxiety. There was a lot of fear about it. And as we gradually started knowing about it, we started doing the right things that prevented us and try to prevent the spread of the disease. We started putting on masks, staying away from each other, social distancing. In our masjid, if you remember, initially we were praying close to each other, then we started spreading out slowly. So here we are now after about more than a year now, and we are in the US as of today, we have had about 30.7 million cases. So starting off with a few cases, we're up to 30.7, and we are at about more than 500,000 deaths in the United States alone. So if you think about it, close your eyes and think about it for a moment, more than 560,000 deaths. So that's one death is too many. So these unfortunate lives got lost, and we should thank Allah subhanahu wa ta'ala that we survived the pandemic so far, and we are alive here with the blessing and the protection of Allah subhanahu wa ta'ala. So the top 10 states, amongst the top 10 states in the country, our state, Georgia, is one of them. Not at the top 5, but it's at number 6. We have had about 1 million cases in the state of Georgia, and about 18,000 plus deaths in the state of Georgia. The top 3 I will mention are California, Texas, and Florida, followed by New York. So we're not behind. We're number 6 in the list of cases in the country. I'm going to ask a quick pop quiz. Does anybody know what's the total population of the United States? Right. So 328 million. And the COVID cases that we have had are about 30.7 million. So that's roughly 11% of the US population has been affected. It could be more because there are some cases who didn't get tested and we don't even know about them. They may have had disease without knowing it or without being recognized. And the number of people who died amongst these 30.7 million is about 560,000. So that makes it about 1.82% death rate. So if the whole of the US population were to contract this unfortunate illness, may Allah protect us all, and you extrapolate this data from what we have seen so far, there would be about 6 million deaths. So we cannot afford that. We cannot. Some of the proponents of the ways that we can face this pandemic is by allowing herd immunity by natural infection. So if you do that and all the population, not all, but almost all the population gets infected, but it will be at a huge cost. Not only the disease, the illness, severity, but the death. So you have to be really ready for 6 million deaths. One death, as I said, is too many. So we can't really afford to have that kind of an immunity by allowing everybody to acquire the disease. So the other way of protecting this, besides, I will make just point here that besides what we're doing on a day-to-day basis, washing our hands, staying away from crowded places, social distancing, wearing the mask, the other way is by way of vaccines. So, alhamdulillah, the vaccines that we have, 3 of them are approved. They are remarkably safe. They are remarkably effective, and they may have saved at least 40,000 lives so far. It will be more, inshallah. So FDA has approved 3 of these vaccines so far. Number 1, as we all know, was approved in December, the Pfizer, which is 2 doses separated by about 3-week period, so 21 days apart. And it's an intramuscular injection given in the shoulder deltoid area, used for ages 16 and above. And it's very effective. The effective percentage rate is about 95%. Second one that got approved, as we know, is the Moderna, which is also 2 doses separated by a little longer duration. It's 4 weeks. So Pfizer one is 3 weeks. This is 4 weeks separated apart. And it's approved for ages 18 or older. Again, effective about 95%. So highly effective. We rarely see vaccines that are as effective. The third one that got approved recently is the J&J, which is the Johnson & Johnson. And it's not 2 doses, it's a single dose, approved for ages 18 and above, and it's about 85% effective. So alhamdulillah, we have 3 choices. So the mechanism for these 3 vaccines I'll briefly mention, not going into too much of depth or technical terms. The Pfizer and the Moderna ones are mRNA vaccines, which is the abbreviation for messenger RNA. It's a kind of protein. So when the disease got detected early on in Wuhan, China, Chinese were able to decipher the genetic code, so pass it on to the US and major pharmaceutical companies, and they came up with this messenger RNA, which they incorporated into the vaccines. So typically, if you look at other type of vaccines, to trigger an immune response, protective response in the body, how the vaccines are developed is you inject a inactivated or a weakened virus or a weakened bacteria, which is not active, which is inactivated, into the body to elicit a protective response, to elicit an immune response by way of antibodies. But these vaccines don't do that. There is not an inactivated virus. There is not a weakened virus here, but it's this messenger RNA. And so what this messenger RNA does when you're injected with it, shortly after that, they will teach our immune cells in the body how to make a protein. The specific protein that's involved here is known as a spike protein. You may have heard that term often on TV. So that spike protein is the similar protein that the coronavirus has on it. If you imagine a ball, that's the coronavirus, it has these little spikes on it. So those are the spike proteins that induce the illness in a person. So we're trying to mimic, or the vaccines are trying to mimic the same response by giving this messenger RNA, which is taken up by these immune cells in the body, and then there's production of this spike protein. And spike protein is the one that elicits this immune response, which is the protective response within our body. And how does it do that? It produces antibodies. So the antibodies are the ones that are produced in our body, and when a vaccine attacks us, the antibodies will try to kill that vaccine. So that's how this vaccine works. The third type of vaccine, which is the Johnson & Johnson, uses the double-stranded DNA. The first 2 are messenger RNA. This uses a double-stranded DNA, where the gene for this COVID spike protein is added to another virus called adenovirus 26, which is responsible for cold and flu virus. And then the body produces defense mechanism against it. So that's briefly how these viruses work and how they cause our body immune system to produce these antibodies. And one way of knowing that for sure is by doing a blood test, by doing a serologic test, and detecting the amount of these antibodies. So it's not recommended, but if one wants to know after a vaccine is given that if their body has these antibodies, you can do a simple test for that. We have a specialist here. He can advise us more about that. So, so for these viruses, there has been a huge rush and demand for, sorry, I keep on saying viruses, huge rush and demand for these vaccines. You would have seen queues, and when the appointment line opens up, it gets filled up quickly. Alhamdulillah, we are going to have more and more spaces available. So as of yesterday, about in this country, about 170 million doses have been distributed, and out of which about 130 million were administered. So that makes it about 77% of what was distributed has been utilized or has been administered. And about 85 million of the US population has received at least one dose. So about a quarter of our population, you can say, has at least received one dose. About 46 million of US population is fully vaccinated. That means they have received two doses. So that's about 15% of the whole US population has received two full doses and should be fully vaccinated. Amongst the state, how does our state of Georgia behave? So between the distribution and the administration, we are not at the lowest number, but we are pretty low. The top one is North Dakota, where the amount of distribution and the amount of administration is at 88%. So 88% of what was distributed to them has been administered. Georgia, we are 49th in the country, actually. We used to be at the bottom. That's what my news was telling me, but we are at 49. We've gone up a little bit. So we're at 67.4%. The last one is Alabama. So even though we've seen huge rush and demand for vaccines, but unfortunately, at the same time, there is reluctance. There are some people who don't want to get vaccinated, and they have one reason or the other. Could be some common misconceptions, some misinformation, some myths being circulated, even in well-educated communities, especially on social media. So, but I will just tell you one thing: we need to look at the real science and ignore the conspiracy theories that are often spread out on social media. A word about eligibility criteria. If you remember early on in December, the eligibility criteria was that the healthcare workers, the first responders, as well as the frontline workers and elderly people over age 65 were in the first group of people who got vaccinated. Then now it became easier, then it was changed to 55 and above. So that increased the amount of people who could get vaccinated. And then teachers were included, teacher aides, assistants were included. And as of today, on Tuesday, Governor Kemp for the state of Georgia ordered that all adults are eligible now for vaccination. So there's no eligibility criteria. So any adult in the state of Georgia is eligible as of today. So the question often comes or is asked by people is, will this vaccine alter my DNA? Are there going to be any changes in my genetic system, my DNA? The messenger RNA or the DNA from the vaccines actually never enters the cell. You remember the cell, we learned that in our school years, high school years, the cell has a nucleus. The messenger RNA DNA from these vaccines never enters the cell itself. So it does not interact with our own human DNA. So there's no chance that it will alter that. And another frequently asked concern or question nowadays is we're hearing it in the international media from other countries, and even now here are these new variants of COVID virus. Virus, the history is such that the general history is they constantly change through mutations. So they are constantly mutating, trying to protect themselves, and they produce these new variants. And these variants normally happen over time in viruses, and these variants may persist or they may get destroyed and disappear. So some of the new variants that have come out recently are the UK strain, the South Africa strain, the Brazil strain. They came out in this country in January of this year. And these variants, unfortunately, seem to spread more easily, more quickly. They lead to more cases and they lead to higher amount of deaths. So that's a concern. But alhamdulillah, fortunately, studies suggest that the antibodies that are produced by these vaccines, the Moderna vaccine, the Pfizer vaccine, and the J&J vaccine, they recognize these variants. But there are ongoing studies to look at those things. So that was my brief introduction about the vaccines. I have compiled a big list of frequently asked questions, but I'm not going to read through that. I'll just stop here and see if anyone has any questions. Just for the people who have joined us on Zoom, we are at Masjid Uthman. We didn't have that mentioned on the flyer, and alhamdulillah, we're amongst a big group of people here in our masjid, socially distant, and so I will stop here and see if you have any questions. If you don't, then I'll keep on going through my list of questions. Yes, Khalid. So children are considered low-risk people, but that may change, as more and more people, adult people get immunized. Children may be the high-risk group of population now. So the initial studies for the Pfizer and the Moderna did not include children. Pfizer one actually included 16 years and above. The Moderna one was 18 years, so was the J&J. But as of today, there are ongoing studies that are looking at children ages 12 to 16. And I was even hearing that there may be studies ongoing to look at the safety in children below 12 years as well. So at this time, there's not any study that has looked at the safety or the efficacy of vaccines in children. Yes. So unfortunately, you cannot choose unless you shop around and see which place is giving which vaccine. All three vaccines are good. They are highly effective. They are highly safe. So 95% efficacy is pretty good for the Moderna and the Pfizer, 85% for the J&J. So I would say any of the three is fine. With J&J, the advantage is that you only have to have one injection, one shot. So side effects are common. Yes, if you take Tylenol, there are side effects. If you take Motrin, there are side effects. Any medication will have side effects. But unfortunately, so far, what we have seen with the amount of vaccination that has been done here, 46 million people have had 2 doses, 85 million have had at least 1 dose. There has not been any pattern of serious or life-threatening side effects in the US population. But there could be mild symptoms. I got my vaccine early on in December, and my second dose was in January. So with the first dose, I felt a little sore here. I felt a little sleepy. I was fine within 12 hours. In the second dose, I got a little more body aches, and that lasted for probably a day, less than a day. But I was fine. And I was even able to go home the next day after the second dose. So mild side effects are there. You just have to bear them out. Answer is we don't know yet. But there was an early study looking at the Moderna. There was a phase 1 trial Moderna on the Moderna vaccine. And in that, they found out that the antibodies last about 4 months, and after which it starts to slowly taper down. So there are ongoing studies. But at least we know that with infection, there is production of antibodies, but those antibodies are short-living. And 10% of the people who get infected do not even produce antibodies. They may not produce antibodies. But for the vaccine, yes, antibodies are produced. How long will it last? We don't know. That's why these two companies, the Pfizer and Moderna, they are trying to develop a booster dose. For that, there will be need to have serological testing where you check antibody levels. If it's low, then you will need a booster dose. And that booster dose may also include protection against these variants, which are the variants that I was mentioning to you. So that may be coming out soon. Inshallah, there was one question here in the knowledge. Yes, sir.
Suppose one person got COVID and he got recovered.
Yes.
Do they that person also need to be taken
Vaccine. So I'll repeat it for the sake of our participants here. The question is, if someone has had COVID-19 infection, should they or can they get a
after recovery?
After recovering? The answer is yes. Answer is less. How long do you wait? Usually you would want that acute illness to subside, to be over fully, and you're out of your isolation period. And especially if you've been treated with monoclonal antibodies, there is treatment available, couple treatment options for someone who is sick, not very sick people, like someone who's on a breathing machine and is not doing too well, not for them. But people who have mild illness, there are antibodies, there are monoclonal antibody therapy, and there's also another medication, remdesivir. Uh, so especially if you have been treated with those agents, you have to wait 90 days, up to 3 months. But not necessarily for those who are infected. Once their acute illness is gone and they're not sick anymore, they can potentially have the vaccine.
Those who are not hospitalized,
Anybody, whether you're hospitalized or not, once the acute illness subsides and they recover and they're fully well, but not during acute illness. You should not get vaccinated during acute illness. Obviously. Yes, inshallah, yeah.
I think there's
one online. If you could just read that. Do you have access?
Yeah.
Okay.
Well, I think it plays on a previous question. Will we be vaccinated for this virus every year, like the flu shot?
Yeah, the definite answer is, the question is, will we be vaccinated every year for the COVID-19 vaccine? Answer, we don't know yet, but as they're trying to develop booster doses, but as I mentioned early on, we need to probably study people's immune response, study their antibody titer. If the antibody titer is not low, they may not need it. If the antibody titer is low, then they may need a booster dose. That happens even with the vaccines that we are administering to people. For example, for hepatitis B. Hepatitis B is a series of 3 injections. So you give that, then after a period of 6 weeks, you check the antibody titer. If it's still low, we can give another dose, booster dose. Same thing may apply here, but we don't know that answer for sure. So, right.
Some of the churches have advised their congregation not to take the Johnson & Johnson because it's from stem cells aborted fetuses. Is that true or is that a rumor?
I would say it's a rumor. I haven't heard that. It may be a rumor, but I will look into that and give you a definite answer. I don't know if you want to add anything on that question. No. So no, I haven't. So I would say any of the vaccines are all good. Yes, yes, Rabbi.
So going back to the side effects,
I don't know if you can choose that option. If you can, sure, you are better off being home for the next day and not have to go to work. But if you cannot choose, I worked throughout the 2 vaccinations that I got. I didn't have to take off from work. But usually they do mention that when you get the second dose, you may want to keep off the next day. Not so much for the first dose, but the second dose. And if you can choose to have the option, you may want to take the second day off or after the second dose. Yes, Hamza.
Another question on mine was, what about rumors that it affects DNA and fertility of women?
Yes. So that's a good question. That's an excellent question. So I'll repeat the question. It is the question is it safe to get a COVID vaccine if one likes to have a baby down the road, right? So there is no effect on fertility as far as we know caused by this vaccine. So there's not, and no evidence that vaccination causes any pregnancy problems, including the development of placenta. The answer is no. If somebody wants to have a family, have kids down the road, it's safe for them to get a vaccine. Well, actually, it eases the precautions a lot. So if you have been vaccinated, you have had your 2 doses, and you would want to wait 2 weeks after that for the full protective response. And then there are several things you can do which you were not able to do before. And one is that you can gather indoors with fully vaccinated people without a mask. So you can go and visit your family who are already vaccinated, you don't have to put a mask on. You can gather indoor with unvaccinated people from one household. So if you are in one household, some are vaccinated, others are not, you can gather there without a mask, unless one of the people that is in that gathering in your household is at high risk, then you should not do that. Then once you are vaccinated, if you get in contact with a COVID infected person, you can forego the testing. You don't have to do testing unless somebody gets symptomatic. So that's an advantage. Otherwise, right now, if you're unvaccinated and you're in contact with somebody, you're really better off getting yourself tested. So if you're vaccinated, you don't have to get tested unless you develop symptoms. But then also what you have to do is you still have to wear a mask in public, even though you're vaccinated. Avoid crowded places. You can defer or delay your travel and stay away from others and get tested if symptoms. So there are still some precautions, and the most important of them is still to keep your mask on in public places. Yes, Ishad, question. Yes. So the question is, if one has had first vaccination and they have missed their second dose, what should they do? So the company, the Pfizer and the Moderna have a kind of a 4-day grace period before or after. So if you missed it, try to get it as soon as possible. But what you've seen also in some states where there was the shortage of vaccines, they have delayed the second dose by up to, not just the 4-week period, they've gone up to 2 months. So you can still get it as soon as you can. Try to get the second dose because it will boost the immune response. Yes. So usually the recommendation is someone who is acutely ill, and we don't know what kind of illness it is. If it is COVID illness, definitely no, they should not until they are fully recovered. But also if they are ill from some other acute illness, so it is advisable not to get a vaccine during an episode of acute illness when somebody is having fever or other symptoms. Please.
Something related, I know that is
So the question is conspiracy theories about 5G and microchips being injected in our bodies and then will be monitored. And so the short answer is no. These are all conspiracy theories. So don't believe these conspiracy theories and what is spread out in social media. Look at the science, look at the data, look at the results of the studies, and look at the effect that it has had on people who have been vaccinated and the positive response. So I would say ignore that and try to educate people. Another question? Yes, come.
So, the person who gets vaccinated, is he free to travel around the world, the country where the COVID is there?
Well, COVID is everywhere, but there are some European countries, especially these days, where there is a third spike happening. If you're vaccinated, if you can delay your travel, best. If you have to go, you still have some protection, even against the variants. But if you can avoid it, best. If you can visit that country and be amongst people or your loved ones who are vaccinated, that would be one safer approach.
So I think the previous guidelines were that people traveling internationally have to get themselves tested.
Right.
And once you are tested negative,
Right.
then perhaps you don't have to go and get quarantine to the place you visit. So
I think it may still apply so far because it's not a widespread. Because even here, only a quarter of the people have had one dose. So in other countries, we are way ahead of other countries. So I would say that still may apply. It may be dependent on the airline you travel. You may still be required to have a COVID test negative before you travel, or you may still be asked to self-quarantine at your place where you're going to. For example, you're going to visit your family in India, you may be asked to write something down that you'll be self-quarantining yourself for a certain number of days. And I know when people are traveling back home, they get tested at the airport. And so they do still test people when they're traveling, coming from other countries. So at this time, the question is, when will the vaccine be ready for kids? At this time, the Pfizer vaccine can be given to 16 and above. The Moderna can be given to 18 and above. So there is no recommendation at this time to give it to the kids. As I said, there are studies looking at the age group of 12 to 16 and even age group of below 12, so that school-going kids and high school kids can also get it. But we don't know them. We don't know when that will happen. Yes, Hamza. Yeah, again, the question about, well, it may be a different question. Can you get a vaccine? The question is, can you get a vaccine while one is pregnant? No. Okay. Not that I know of. Not that I know that it's from stem cells made out of. If anybody knows about it, please feel free. I may not have all the information, but as far as I know, to my knowledge and understanding, the vaccine from Johnson and Johnson is not made from fetuses. Well, some people have a religious thought. Some may have some other reasons. Some don't believe in stem cell therapies, anything related to human fetuses or some other fetuses. They may have an objection to that. But I will mention here that one of the frequent asked questions is also, are these vaccines halal? So there's a fatwa from Ajma, American jurist of Muslims of America, and they have said that this vaccine is not only permissible, it is obligatory on people to get this vaccine because it prevents this dangerous disease. So, and then ICNA, ICNA has said that there is no religious prohibition for these vaccines. So knowing that, I don't know if that helps the person who was asking the question, that it is, there's a fatwa that you can get these vaccines and it's not allowed, it's actually strongly encouraged. Any other questions? I want to see if there's anything on the chat. Yes, I will repeat that what Brother Khalid mentioned, that the Grand Mufti of Saudi Arabia gave a fatwa that the Ramadan month is approaching. Should people get vaccinated during Ramadan? And they said it's allowed because it's not going in your mouth or the GI tract. It's an intramuscular injection going into your muscle. So even you can get a vaccine while you're fasting. I don't see any more questions online unless somebody just wrote it. Any other questions from any brother or any comments? There will be like, will be taking this, there will be a fear. So question is, where can I get a vaccine? Not where can, like, or fear. Yes, obviously, anything that we do in life has a fear, and knowing some of the concerns, there is a hesitancy about um, vaccines. So you have to look at what is the reason. Um, there is no one single answer for someone who is hesitant. It could be different reasons. For example, I can talk to you later on, and if you have some particular reasons why you're hesitant about, then I can try to see what is the reason that you are hesitant about, and then try to address those issues with each person. So I don't think there's one single reason for being hesitant about it. Some may be a religious reason, some may be the past history of vaccinations in this country, especially in the 1980s, so in the 1800s, about the smallpox vaccine, then the vaccination or the STD trials in the African American population. So there are some genuine concerns. So it just means that you have to open the channels of communication. You have to educate people. You have to look at the science and try to see what your particular concern is. Address that. Actually, CDC has a toolkit that may be helpful if you go to the CDC communication site. Sorry, you go to the CDC website. There's a communication toolkit that will give you videos, graphics, and some social media posts. So that's a helpful tool for someone who is hesitant or reluctant about getting a vaccine. Yes, sir. So the question is, if we have our parents or relatives visiting us here from other countries, will they be able to get a vaccine? I would say yes. By Georgia law, it says all adults. It doesn't talk about their immigration status or their legal status. So I think there are some mass vaccination sites available here, and one of them I know is in downtown. That they're giving at least 6,000 doses each day, and it's very easy to get a vaccine there. So wait time was about 30 to 45 minutes only, and they're not doing in the field area. They're doing surrounding where the seats are and the chairs are. So it's a very smooth process there. So there may be a need to register people, or some of them, the pharmacies, now that it's opening up more and more doses are available. So I think it will be available more widespread in all pharmacies. So it should be possible to get that. Yes, sir. Yes. Yes, yes, that's a very good question. So how should one deal with the vaccine when you are allergic, when you are allergic to a lot of things, whether it's pollen allergies or allergies to medication, allergies to penicillin? That's a frequent question asked. The answer is yes, you can still get one of these vaccines. The usual time period to monitor a person after you get a vaccine is 15 to 20 minutes. But in that case, if you have a history of allergy, then you would want to be watched for about 30 minutes. Okay? But if the allergy happened to this vaccine, which would have been a severe reaction, we call anaphylaxis, where there is difficulty in breathing, there is a swelling of the throat, there is whole body rash, blood pressure drop. So that's a severe anaphylactic reaction. So that happens to one dose of vaccine, then that's a contraindication to get the second dose. And also, if there's immediate reaction that happens, which is not as severe to the first dose, they also should not get a second dose. But any person who's previously been allergic to other things, other than the ingredients of this vaccine, and one of the ingredients is polyethylene glycol, PEG. So if you have an allergy or history of allergy to PEG or polyethylene glycol, then you cannot get this vaccine. But other than that, yes, if there are penicillin allergies, hay fever, asthma, and all of those, you can still get it with caution.
is it safe to get vaccine for breastfeeding?
Yes, yes, I read it. I'm not 100% sure. You mean is it safe for the mother or for the baby, for both? Yeah, I don't think it gets transmitted uh, by lactation, so it should be safe. But I can double check if you can note that person's name and details. Inshallah, I'll double confirm that. But as far as I know, it should be safe for lactating mothers also. But there haven't been trials in them. I was just listening to CNN before we came, and there was a someone from Boston, an expert, who was saying that yeah, if she would become pregnant, she would still take the vaccine, and uh, and I don't see any contraindication for lactating mothers either.
Questions about kids' vulnerability?
Yes. So is kids age 12 below vulnerable to corona as same as adults? So the kids are in general less vulnerable, but if they are in crowded places, in classrooms where they are close to each other, they could be vulnerable. As I mentioned, that there may be an emergence of protection in the adult group because of the vaccine, and the kids are not immunized. So they may be the more vulnerable groups now, as more and more people get vaccinated. So that's why the result of these trials in kids 12 to 16 and under is important to know if it's safe to give vaccine to the kids.
I think we can make this the last question.
Yes.
The question about which vaccine is most effective.
So I told you about the percentage effectiveness. I will repeat it. The Pfizer one is 95% effective. Moderna is the same 95%, and the the J&J one is 85%. So all are highly effective. 85 looks less, but it's very effective. No other vaccines, that we have known of in the past have had such effective rates. So I will end up here. Maybe, inshallah, you can make a little dua for all of us. Okay, alhamdulillah. Jazakallah. I'll hand over to Hafiz Saab for a dua.
اللهم أنت السلام منك السلام تباركت ربنا وتعاليت يا ذا الجلال والإكرام. اللهم صل وسلم دائما أبدا على حبيبك ونبيك محمد صلى الله عليه وسلم وعلى آله وأصحابه أجمعين. اللهم ربنا تقبل منا إنك أنت السميع العليم وتب علينا يا مولانا إنك أنت التواب الرحيم. اللهم ربنا فاغفر لنا ذنوبنا وكفر عنا سيئاتنا وتوفنا مع الأبرار. بسم الله الذي لا يضر مع اسمه شيء في الأرض ولا في السماء وهو السميع العليم. وصلى الله على خير خلقه محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. جزاك الله خير everyone for joining.